Hey, what's up, guys? This is Brandon with Low T Nation coming at you guys again from the kitchen. And I'm frustrated today, man. I've had 2 meetings today with 2 different doctors. They got a hold of us because their patients were on our program. They're also our patients. And these doctors were absolutely filling their patient's head full of BS. I don't want to be, too dramatic on this thing, but it's total BS what they were telling these patients. They were telling them that being on testosterone was dangerous. And I'm like, well, what part of the therapy are you concerned about? And they're like, well, you're going to give them heart attacks. Everybody knows that. And I'm like, Doc, everybody doesn't know that. The people that think that are wrong. The people that really know the truth about the testosterone program know that that's incorrect. So I had a long conversation with both of them. One of the doctors was all ears. I showed him some studies, and the guy completely changed his stance on this. And the reason I'm still frustrated right now is my last conversation didn't go so well at all. I offered to show that doctor what the information that we have that I'm about to convey to you guys. Wasn't interested, didn't want to hear it at all. He just knew testosterone caused cancer, caused heart disease, caused diabetes, caused all these things, and he didn't want to hear anything to the contrary. So I'm going to go ahead and give you guys some information in case you ever hear something from your primary care doctor, some negative information about testosterone therapy, and we're going to seriously talk about some of the negative aspects of it, but and really put that into context as to, is it really a risk, or is it something that just has to be watched and managed down the road? First and foremost, in my opinion, excuse me, in my opinion, testosterone therapy is one of the absolute healthiest things that an aging man can take, or any man if he has a deficiency for some reason. And there's a lot of reasons why, but there's an enormous amount of information out there that talks about diabetes, it talks about atherosclerosis, osteoporosis, it talks about metabolic syndrome, and all of these in relation to testosterone and testosterone therapy, okay? Almost all of the studies, and I dare say, and I know I'm going to catch some flack for this, but all the studies that are done right, all right, show that patients, when they get on these programs, are more protected from those nasty conditions. And we're just going to talk a little bit about the heart disease aspect of it now. Now, there's a lot of studies out there. You'll see some studies where like 5 men that were over 75 in a group of 15 had a heart attack when they were on TRT. There's a couple studies like that. And, they were over 75, and this is one of the things. We don't put fragile patients on testosterone therapy. If a patient is very fragile from a cardiovascular perspective, I don't want to be the responsible party for making him feel a lot better and having a lot more energy and now getting out and moving and doing more, because that can cause problems. It's going to take a lot longer for any kind of a therapy at all to normalize that guy's cardiovascular profile to be able to accommodate that kind of activity. So you got to be a little bit careful about re-energizing somebody that's on thin ice, and that's where most of those studies come from. The study that I want to talk about today is by far the most comprehensive study with heart disease and testosterone that's ever been done. It was produced by the European Heart Journal, and it was released on August the 6th of 2015. This was a bunch of, even though it was the European Heart Journal, it was a bunch of American veterans that they collected this data on. Some of the data point criteria were all of these men were 50 years or older, and the follow-up period between when they started working with these guys and when the study concluded was somewhere between about 4 and 6 years. It was about 4.5 to 6.2 years, okay? Now, the good thing about this study is it was unbelievably comprehensive. As you can see, there were 83,000 patients studied in this group, and they broke those into 3 groups. There were 45,000 or 44,000 that were treated and treated well. That means their testosterone levels were able to get into a good normal therapeutic range, and I think the therapeutic range for this study was 500 to 1,000. There was also a study, or a percentage of this group, it was about 25,000 of these that were treated but never got into an optimal level. Now that either means 2 things. They weren't treated right, or the patient wasn't compliant with their program, and that's definitely a video for later. But for whatever reason, the patient did not make it into the level in order to be considered, treated well. And there was also basically an untreated group in this study that was about 13,000. All right. The group 1, as compared to group 3 here. These are just some of the numbers. Now, in the description of this video, guys, I'm going to put 2 or 3 links to this study. I'm going to put a link to the actual study. Unless you're a statistician, you're not going to be able to tell, heads from tails on that at all. But there's a couple other sites that have broken this information down to where it's actually, palatable for an average person to read, like me. And so, definitely go and take a look at that. There's more to it than just this, but I just want to show you guys some of the highlights regarding testosterone therapy and heart disease. Of these 44,000 as compared to the 13,000, the treated group, okay, the guys that they were able to get above 500, were 56% less likely to die during this 4 to 6 years. 56% less likely to die. These are real numbers, guys. This study has been scoured by the medical community because so many people wanted to disprove it and prove it wrong, but they did the study so well that it's infallible data, all right? Also, 24% of these guys were less likely to have heart attacks, MIs, myocardial infarction, and 36% of these guys were less likely to have a stroke, again, during that 4 to 6 years if they were treated. That is profound. I mean, that is absolutely profound. And this study didn't look at all at estrogen. That's another component of cardiovascular health that we look at tremendously at our clinic as well. The study didn't take into consideration were they on HCG or any of that stuff. It was just we gave them enough testosterone to get above 500, and in this 4 to 6 year period, these guys that were treated versus the guys that were not treated, 56% less likely to die, 24% less likely to have a heart attack, and 36% less likely to have a stroke. So that means there's no danger, right? No, it doesn't mean there's no danger. It means it's got to be done right. But when it's done right, it seems that all the studies that are now done well are pointing to the fact that it's less dangerous to have a good testosterone therapy than to have low T. Guys, low T is the killer here. Low T is absolutely dangerous. It's deadly, all right? But again, a mismanaged testosterone therapy can also be equally dangerous. So what does make a good, healthy testosterone program? Well, first and foremost, and I actually say this all the time to doctors, the most important way to keep your patient base safe as far as a clinic, talking about their patient base, is to start with healthy patients. I don't want 75 and 80-year-old patients in my patient base, or at least a large majority of my patient base, because guess what? They have a ton of things going on. They're on thinners and statins and ACE inhibitors and you name it. They have all kind of other issues going on. And if they have low T, who knows how long they've had low T? And that's one of the issues is these guys are frail. They have a fragile cardiovascular system. And you know what testosterone does. Their energy levels are going to go up. Their focus and concentration is going to go up. Instead of sitting on the couch, they're going to want to go do more things. Sometimes the heart might not be ready for that. All right. So we start with healthy patients in our clinic. PSA is very important. We make sure that the patient's PSA is within range before we ever start. We never give a guy a shot at all until we've looked at his PSA and his testosterone levels, ever. You can't be giving guys testosterone that have elevated PSA. If they have active prostate cancer, the testosterone can exacerbate it. There's a lot of different schools of thought on how bad it will exacerbate it, but we don't even care about that. We're not going to do it, all right? And if we are going to do it, it's going to be, with a hand-holding procedure with his urologist to make sure that everybody's on the same sheet. Hematocrit, it's the volume of red blood cells in a certain volume of blood, or the amount of red blood cells in a volume of blood. That's going to climb. I'm going to set this down for a second. That's going to climb over time. That makes your blood a little bit thicker over time. There's a cutoff range, depending on the clinic, of somewhere between like 50 to 53. The good thing about climbing hematocrit levels is that as hematocrit levels climb, all you have to do is give blood, and it goes back down every single time, like clockwork. You can give blood at the Red Cross, I think, every 53 or 56 days. We try to nudge all of our patients to do that as much as possible. And if a guy comes into our clinic and he has a very elevated hematocrit level, we'll just do a therapeutic phlebotomy or bloodletting procedure in the clinic. We'll pull off 500 milliliters or something like that of blood, about a pint of blood. And we want to do that like 2 times in about 2 weeks to get that level back down below 50. One of the arguments to this, just to make you guys feel a little bit better about this, everybody in the world that lives at high elevation, because there's lower oxygen in the air, the body needs more red blood cells to carry an adequate amount of oxygen. Everybody that lives at high elevation has elevated red blood cell counts, almost to the point of something called polycythemia, which is the actual clinical condition for having too many red blood cells. And there's not a higher cardiac incident rate at elevation versus, sea level or lower levels. So I don't want to say it's not a big deal. It is definitely a part of the recipe, but an elevated red blood cell count by itself is not true cardiac risk, or it doesn't reflect true cardiac risk. I'm going to skip over this routine testing for a second. Another thing, in order to keep you guys as healthy as possible, you have to manage your estrogen. And this is another thing that when you go to your primary and you're doing your testosterone program with your primary, it gets neglected. High estrogen is also dangerous, guys. It causes cardiovascular issues. Very low estrogen, if they just throw you on an estrogen blocker and they're not watching those levels, can cause osteoporosis and also cardiovascular issues. So let's make sure that the estrogen that you guys are, your estrogen levels that you get to when you're on the program are somewhere between the 20 and 30 range. That's the optimal level. It's a little bit hard for some guys to keep it, right in that level, but somewhere between the 20-ish and 30-ish range is optimal for most guys. Okay, that's where we try to keep all of our patients. And also, in my opinion, unless it's a much older patient, everybody needs to be on HCG. If you don't use HCG, your own natural production is going to go away. You're going to suffer atrophy, you're going to suffer shrinkage, and after a long period of time, you're actually going to suffer a lack of production. Or a lot of guys will come back and suffer a lack of production if you stop testosterone. All right, so what we don't want to do is impact your future production of testosterone, so everybody needs to be on HCG. And think about this as well. If you're on a program that's a good program, routine testing is going to be part of that. A doctor's going to want to see you 2 to 3 times a year to know where your blood work is in case they need to make any tweaks. It's just good medical supervision to know where your patients are at. The average guy goes to a doctor every 3 to 4 years, okay? Things can happen in 3 to 4 years. A lot of things can happen in a guy's body in 3 to 4 years. If you're on a testosterone replacement program that's worth its salt, you're going to be getting tested. So if something else, if your liver is going out of whack, if your pancreas is going out of whack, there's a million other things that could be happening to you. If those things start to creep in the dangerous direction, your doctor's probably going to catch it, because the testing that at least we do is very comprehensive. We catch stuff all the time that is completely unrelated to testosterone, and guys probably wouldn't have had it caught for a year or 2 or 3 down the road, depending on how compliant they are getting their physicals every year. So routine testing not only is going to catch something down the road. If you hadn't started a testosterone program and you say, you know what, I need to go and start, I can't tell you how many things we catch on day 1 with these guys. We're like, we think you have a pituitary tumor, or we think you might have colon cancer or something like that. Obviously, we don't say it like that, but it turns out to be the case. It's just more good, solid medical supervision and medical intervention into your life and your health. All right. So all of these things put together, it's way safer to take a good testosterone therapy than to have low T. We're going to follow this up with some other videos later, guys, but I hope this helps just in regards to the heart disease video. If you have any questions, don't hesitate. Just hit us up on Facebook, post a question in the channel here on YouTube. And again, take a look at the studies. The links are going to be posted in the description of this video. Take a look at the studies. And again, if you have any questions, hit us up at lowtnation.com. Again, my name is Brandon. I'm the CEO of lowtnation.com. Hit me up directly if you want. Look forward to hearing from you guys. Have a good day.